Hello, my name is Jill Deaver. I'm the head of the Lister Hill Library of the Health Sciences Department for Clinical, Academic, and Research Engagement. I'm with my colleague today, who's going to introduce herself.
Hi, I'm Emma O'Hagan. I'm the Clinical Services Librarian here at UAB Hospital.
We currently have an opening for a faculty position for a reference librarian and liaison to the School of Public Health. We've made this video to help you become more familiar with the University of Alabama at Birmingham, UAB, and Lister Hill. So a little bit about our work culture. So who are we? The Clinical, Academic, and Research Engagement Department, or CARE, is a team of 9 dedicated faculty and staff. We're a dynamic and fast-paced work environment and committed to supporting high-quality research at UAB. For training and support, we offer a structured training program to help you build your expertise. We believe in work-life balance and encourage bringing your whole self to work. And the way that this works is by communication and being flexible. And we think that those are essential to our success. At UAB Libraries, we believe in an innovative culture. We welcome fresh ideas and new approaches. In collaboration, faculty and staff collaborate all the time across departments. We have a lot of engaging committees. There are some really fun ones, or you're welcome to create your own. Leadership is very approachable here. Dean Gonerman, we interact with her all the time. She's very approachable. And we do have a formal mentorship program to last your first year. So at UAB, it's a really positive environment. The people at UAB truly believe in UAB's mission. We're smart and friendly. You'll work with a lot of very smart and nice researchers across campus. And the research is backed by impressive funding. And as librarians, we're very highly regarded with strong reputations across campus. So a little bit about our users. We have 7 health sciences schools, including the School of Public Health, but there's also medicine, health professions, nursing, dentistry, optometry, and the joint health sciences. We support master's and PhD students and practical doctoral degrees like the Doctor of Public Health and the Doctor of Nursing Practice.
And while we do see more graduate students at Lister Hill, there is a Bachelor's of Public Health, and we also get a chance to work with undergraduate students from other health sciences undergraduate programs. And not surprisingly, we also spend a lot of time working with our health sciences researchers and faculty at Lister Hill. And we also have about 185 really high-performing faculty in the School of Public Health. So, as I said, we have really impressive faculty at the School of Public Health. Last year, they published over 500 peer-reviewed papers. They received $42 million in extramural funding, and they ranked 29 in funding among schools of public health. We've also seen exciting growth in our undergraduate and graduate programs who can enroll in one of these 5 departments. So you can find all kinds of incredible projects from our public health faculty on their department website, and also just in the media in general. I think one of the really exciting things about working at UAB is that when you're driving to work in the morning, sometimes you hear about some of these projects when you're listening to NPR, or you read about it in the New York Times. And that's always super exciting and gratifying when you know that this is something you're contributing to. But I also wanted to highlight a couple of especially high-profile studies from our public health faculty, so that you might get an idea of the kind of work that you would be supporting as a public health librarian. So the first is the REGARD study, which is a really long-running study. It's been going on for over 20 years, and it's spurred over 200 ancillary studies and something like 650 published papers. And what this study seeks to do is to try to understand the reasons that Black and Southern Americans have higher rates of stroke and other brain health issues. It's also a really valuable data set for the field of public health in general, because it has recruited over 30,000 participants and it has followed them for over 20 years. So it's something we're really proud of here at UAB. And the other study that I wanted to highlight is the Healthy Birmingham study. So this is a community-based research study partnering with the city of Birmingham. It allows us to assess how housing and neighborhood improvements impact health outcomes by focusing on how interventions like housing renovations, neighborhood revitalization, and indoor air quality improvement might help reduce disparities in lung disease and other chronic diseases. So this is a kind of like more local and really exciting community study that we think will help improve the health of people in Birmingham. And lastly, I just want to talk a little bit about the different paths that might lead you to public health librarianship. I know that generally we think of a background in the health sciences as being the sort of straightest path to going into health science librarianship, but there are a lot of different areas of studies that might give you a lot of expertise and context for public health librarianship, particularly the social sciences, and I would say even the humanities. So a background in something like anthropology, sociology, or political science can have a lot of value for public health librarians because these disciplines provide key insights into human behavior, social structures, and the ways that power and policies shape health outcomes. For example, the cultural understanding that you may have developed by studying anthropology can provide you with insights into the norms and values of different populations, which are important when designing culturally sensitive and effective health interventions. Similarly, a background in sociology would provide you with insight into how factors like socioeconomic status, education, race, and access to resources can influence health outcomes. So really, librarians with a background in a variety of these social sciences or humanities fields can bring a unique set of skills and perspectives that can enhance reference services and improve collaboration with public health researchers and practitioners and students. So don't discount your background just because it's not in a health sciencey or a basic science field. You really might have a lot to offer to this position.
Okay, so here are a few photos of our team. I think most everyone is represented, and we'd love for you to consider joining us. If you have any questions, please email Emma or me. And I'll also be at MLA this year, so I'd love to meet you in person. Thank you for considering